This is standard for all home health and hospice softwares. If your software does not have an alerts report, do not use that software. That is like one of the most basic components of any home health hospice software. Hi everyone, my name is Mariam Treystman from the Home Health Consultant, and today we're going to be talking about alerts reports. But first, if you like our content, please like, share, and subscribe. So what are alerts reports? Well, alerts reports are reports that are submitted annually to the state of California. If your agency is not in California, this does not apply to you. ALIRTS stands for Automated Licensing Information and Report Tracking System. Lots of words means nothing. Long story short, it's a statistical report that we have to submit to the state of California that breaks our patient population or services down into like a lot of kind of statistical and utilization categories. It used to be called a utilization report back in the day and things like that. This is kind of the California state equivalent of a cost report, but it's not as intense and I guess not as detailed around finances unless you're in hospice. The hospice alerts has a little bit more financial kind of components to it. The home health alerts report is very basic and just tries to understand like how many visits have been done and things like that. So we're going to go into just some kind of basic questions that they ask and how to do the alerts report. So let's start. First and foremost, any software that you're going to use in home health or hospice needs to have an alerts report with it. This is standard for all home health and hospice softwares. If your software does not have an alerts report, do not use that software. That is like one of the most basic components of any home health hospice software. Specifically, even though it's a state requirement, because California has such a large number of agencies compared to like the rest of the country, let's say, there are other states that, have a lot of agencies as well. But my point is those states that have a lot of agencies, if that state requires something, then usually the softwares will have a report for it. Without a report for your alert submission, there's almost no way to put this together, because what are the kind of questions that are asked on alerts? Well, I'll give you an example question. So it's like, how many patients and visits in this X calendar year did you have for ages 50 to 59, 60 to 60, and like it breaks down from like 0 to 10, and then like 11 to 12, all the way to like 120. I don't know how many visits I did in a year for like the age category of 60 to 69. Like that is very hard to get. I don't even know how you would put that together. Like you would have to print a list of patients and then manually calculate how old they were at the time of your service and then put them into groups and then like total the sum of their visits. Like, I don't know. And when we're helping people with their alerts reports, the visit numbers are like 10,493, like this. Like it's like some large number of visits. So that is just like one example of a question. Another example of a question could be like, for the diagnosis 459.93, how many visits did you do in that calendar year? Like, so it's just like a lot of like, how many patients and visits did you have by insurance type, diagnosis, age, whatever, discipline. How many CHJ visits did you do in a whole calendar year? Whatever, like this kind of like really intense statistical breakdown that is very difficult to come by unless the software has a report. And Every software I've ever seen in home health and hospice, except for one, has this report. I forget which one, but we have an article about softwares coming up and it'll be in there. So another kind of little fun fact about this and why you should never calculate this manually is because those numbers, like let's say patients and visits by age, patients and visits by insurance, patients and visits by diagonal, blah, 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 blah. At the end, all those numbers need to match each other. So like if you miscalculate the number of like diabetic patient, like, you know, all the diagnoses, if that doesn't add to the same number of patients and visits, and there's like 100 diagnoses at least, okay, it's going to give you errors and you can't submit it. So like it literally has to be down to the exact number of visits total everywhere. But they have like 15 ways they want to collect and categorize how you did those visits. So that's the ALIRTS report for home health specifically. For hospice, it's that plus a lot of money stuff. The reason that home health doesn't really have like a really big financial data collection aspect to it, but hospice does, is because home health typically, while there is home health benefit under like Medi-Cal and things like that, the Medi-Cal payments to home health are so low that most agencies don't participate or don't take Medi-Cal or Medicaid insurance for home health as primary. The payments are very low compared to any other place, any other insurance. And as the law of qualifying for Medicaid, it's a low income group of people, so that you can't be like, if Medicaid doesn't pay, there's no like option for collection. Like my point is, it's hard to deal with this insurance type. So most agencies in California don't take Medi-Cal or Medicaid as primary. But in hospice, Medi-Cal or Medicaid is a very common primary insurance. While with home health, it doesn't do that well. With hospice, it does pay well enough that agencies and providers are willing to participate in it. Like, I want to say one more thing about this, because like sometimes people make business decisions, but like when you talk about it, it sounds a little like yucky. Of course, providers would love to treat Medi-Cal, Medicaid, home health patients. The payment for that is lower than often the visit rate of the clinician. So it as a financial decision, it's like impossible to justify. For hospice, it does cover the costs. And so there are a lot of hospice agencies participating in and taking patients with that insurance. And so the Hospice ALIRTS report has a lot of financial components, and you have to report on a lot of financial kind of things. Like, so for example, like how much payment did you receive from every insurance type? And then in the Medi-Cal section, they're going to break down by visits and things like that. So the hospice one is a lot more intense and requires some financial information that comes from like your cost report, your taxes, and things like that. This is where we often run into issues with hospice agencies and alert submissions. They will hospice. So, okay, you can submit taxes through like April 15 or whatever, right? But then if you get an extension, that extends you through like August, or, you know, I don't know exactly, but through sometime in the summer. Like maybe it's like August 15 or September 1. I don't know what the exact date is. So a lot of people will get the tax extension, but in the process kind of screw themselves, because ALIRTS reports are due like March 31st. And so if you do your taxes on time, we will usually have the info needed to file the ALIRTS report. You need like balance sheet, I don't know, like whatever tax stuff, accounting stuff. But if you're getting the extension, we usually don't have the information needed to do the alert submission. And then you get into a lot of like, I didn't know I needed my taxes. If I knew yeah, okay, great. So this is me telling everybody, if you especially are a hospice agency, do not get the extension for your taxes. I mean, you can, but you still need the reports of the taxes to be able to file the alerts reports. So FYI, get the taxes at least by paperwork done, whether you want to submit it and do your payments or, however you do that, that's your business. But like the information needs to be ready for the alert submission. Until now, in 20 something years of being in this industry, I have never seen a penalty for submitting the alerts report late, but I have seen surveyors ask for alert submission results or confirmations and then give deficiencies for it being late. So that has happened. Is it standard? It is, it isn't. Like it's not like the top item they're requesting or asking for, but occasionally you do have surveyors who want to make sure you are submitting your alerts reports. They care, they'll cite it as a deficiency and things like that. I think that the reason there hasn't been major penalties for the alert submission historically has just been a function of tech. It's probably been difficult for the state health department, California Department of Public Health, to keep track of who submitted and then have some kind of like penalty system or consequence system. But now, as generally tech becomes more integrated into our lives and with other techs, right, they can more easily see who submitted something versus not and things like that. So I have a feeling that in the coming years we will see some kind of consequence for late submission or non-submission, but until today it's been kind of like on an honor system, I guess. I don't know. But yeah, surveyors are asking for it. So FYI, they started asking for it last year, the first time I've ever seen anybody ask for it. So that is alerts. It's a statistical report that we have to submit to the state of California every year. It's due March 31st. With hospice, you need a lot of financial information. With home health, you generally just need whatever your software will spit out. Most home health softwares cover this, and hospice softwares cover this. And by most, I mean all of them except for one. There's one that does not have this report. We hate our lives because of that one. And yeah, if you are that one software and you're watching this and you know it's you, just make that report. It's not hard to make. Like, it's really not hard to make. We used to have a software that was the first report we made. It's like 5 or 6 reports. Just make the report, please. I beg you. Okay, that's that. That's alerts reports. My name is Mariam Treystman from the Home Health Consultant. Thank you so much for watching. And if you like our content, please like, share, and subscribe. Thank you.